Lesson 2. In this lesson, we will discuss COVID-19 with regards to prevention, signs and symptoms, as well as management and treatment of COVID-19.
We can do the following to prevent the spread of infection and to slow the transmission of COVID-19. We can wash our hands using an alcohol hand sanitizer, rubbing for 20 to 30 seconds using friction if it is not visibly soiled. If visibly soiled, use soap and water and wash for 40 to 60 seconds. Maintain a social distance by keeping at least a 1 meter distance between you and other people. Avoid touching your face. Cover your mouth and nose when you cough or sneeze. You can cough into a flexed elbow. If you are unwell, stay at home. We should refrain from habits such as smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. Do not go out unnecessarily. The signs and symptoms at the onset of COVID-19 may vary. However, these are the most common symptoms that have been experienced by people. Fever, 83 to 99% have been reported by people who experienced signs and symptoms of COVID. Cough, fatigue, anorexia, shortness of breath, sputum production, and myalgias. There are other less common symptoms that have been reported, and these are headache, confusion, rhinorrhea, sore throat, and also gastrointestinal symptoms like nausea, vomiting, or diarrhea. Older adults and persons with medical comorbidities have delayed presentation of fever and respiratory symptoms. Several studies have shown that the signs and symptoms of COVID-19 in children are similar to adults and usually milder compared to adults. Let us now look at the illness severity of COVID-19. It ranges from mild to moderate, where there are mild symptoms, up to mild pneumonia. In more severe illness, there is dyspnea, hypoxia, and a greater than 50% lung involvement that is seen on imaging. In the critical cases, patient presents with respiratory failure, shock, or multi-organ system function. We are very grateful to see that the larger percentage of people that present with signs and symptoms fall in the mild to moderate illness severity. And as you can see, 81% of the people fall in mild to moderate severity. We will now look at the clinical management and treatment of mild to moderate and severe disease of COVID-19. For the patients that have absence of viral pneumonia and hypoxia, they may not require hospitalization at the beginning. And thankfully, many patients will be able to manage their illnesses at home. However, with patients with severe disease, they will require hospitalization. Although there is no specific treatment that is currently approved by the FDA for COVID-19, patients that are admitted will receive supportive management of the most common complications of severe COVID-19.
Thank you.